Now, since the start of COVID-19, there have been various, sometimes radical conspiracy theories, and from the denial of the existence of the virus to attributing the pandemic to the rollout of 5G cell towers. How do we distinguish fact from fiction? The list does indeed go on. For more on this, I'm joined by Cayley Clifford, and she is the Africa Check researcher. Good to have you with us this afternoon, Ms. Clifford. If you could give us perhaps some examples of some of the conspiracy theories that have been making the rounds.
Sure. So you mentioned 5G, and there's obviously been a lot of talk around this. It's all over social media. We've heard the comments by KZN ANC councillor Sviso Ngadi, the protests that we saw in KZN. So it can be quite confusing, I think, and I like to sort of start from a place of understanding. What is 5G? It's a mobile network, a wireless mobile technology that allows more than one device to connect to a network at the same time. And how this is made possible is through radio frequency waves. Now, these waves do emit radiation, but it's important to note that these waves are non-ionizing. So it means that they don't damage the DNA in your cells. So I think what's important to note here is that there's no sort of strong evidence between 5G and COVID. And when we look at the link, it's very precarious. If you think about countries like India and Zimbabwe that have not yet rolled out 5G networks, and yet COVID-19 is spreading there. So very little evidence between those two things.
So how did this conspiracy theory actually come to light? What was the possible incident that ignited this whole association of 5G and COVID-19?
So that's an interesting question. And I think mis and disinformation sometimes works in mysterious ways, because this is not a new conspiracy theory. It's been doing the rounds for some time. So we have debunked them previously, and we'll continue to do so. I think especially as countries around the world, roll out their vaccine programs, it's going to become more and more common. So I think another very busy year ahead for Africa Check, and also it's going to be as important as ever that the public verify information before they pass it on.
And another conspiracy theory that has made the rounds, there's a lot of uncertainty around the COVID-19 vaccine and how it will affect individuals. Talk to us about some of the stories that you've heard making the rounds about how this vaccine is going to impact the human body.
Right. I mean, there's been quite a few theories, a lot of stories about how different vaccines in different countries cause reactions. I'm sure many viewers may have seen the story about Australia having to actually abandon their trial vaccine program after the vaccine was resulting in positive HIV tests among patients. So that sounds really scary, but what was actually happening was that the vaccine was triggering an antibody response that was resulting in a positive HIV result. Now, that's not to say that the vaccine was injecting people with HIV, just that it was giving people a false positive result. So that was obviously an unintended consequence. It's not meant to happen. So they have had to abandon their trial vaccine program. And in the meantime, they have upped their existing order of the Oxford vaccine. But I think that's going to be somewhat of a theme, as you've said, as various countries continue to roll out their vaccine programs.
Cayley, you used a phrase there, unintended consequence. And perhaps is this not the major concern that people have about this virus? Yes, there was a triggering of an antibody response in Australia with this particular vaccine, but what other unintended consequences could people be afraid of?
Absolutely, and I think you've really zoomed into the root cause of why mis and disinformation can sometimes spread. It's because people do have a genuine fear. We're concerned. We are being inundated with information about various vaccines. We don't always know what is true and what is not, and what we should believe. But if I could encourage people to do one thing, it would be just to pause. When you receive a piece of information about the vaccine, think about how it makes you feel. Is it making you angry? Is it making you scared? Is it a call to action to refuse to take a vaccine or to take a vaccine? Disinformation is designed to work like this. It plays on your fears, and then you're more likely to share it with people that you know. So if you can kind of recognize that and take a step back, then we think that we could really see a reduction in vaccine misinformation, but also around COVID-19 in general.
So much more to unpack, Cayley, and unfortunately time is not on our side, but thank you so much. At least we managed to talk about 5G and we did manage to talk about the vaccine and the unintended consequences and the fears that people generally have about taking a vaccine that they don't know how their body will react to. That's from Africa Check there, Cayley Clifford.